Okay, well, thank you, Minister Moore. I think you ended on exactly the right place. We all need to change to get more effective. And so it's only fair, since you posed a question to the World Bank right at the end, to ask our World Bank colleague to tell us a little bit, Chico Ferreira, who's the chief economist for the Africa region at the World Bank. They've been working very extensively on estimates of the economic impact. So I'd like to ask him to say a few words about that work, but also maybe to comment on the issues that Minister Moore has just raised. So
Sure.
take it away.
Thank you, Amanda. Thanks very much for the opportunity to be here. It has been a great event so far to listen to Senator Flake and to Minister Moore. I wanted to make 5 brief points, and at the end I'll come back to the question that Minister Moore just raised. So the first one is to sound a note of caution on the title of this event, which is Liberia after Ebola. So I was here not long ago with my colleague Dave Evans and Amanda and a number of other people at a roundtable that discussed this issue. And I think there was wide agreement at that meeting that the time was right to start thinking about after Ebola. But as I said then, and I'll say again, without taking away the focus from the fact that we're still very much in the during. It's fascinating and incredibly heartening to listen to the minister's reports of how things have improved in Liberia, and they certainly have dramatically since September. But the latest numbers that we had are still of the order in the last 21 days. The last report I had is of the order of still 448 cases in the last 21 days and 139 deaths. Okay. Now, we heard from the minister how there's still cases appearing here and there, and I'll come back in a moment to the nature of the economic costs and why it is important to keep the eye firmly on the ball, and I'm sure that the government of Liberia is doing that, to borrow the phrase from my big boss, the President Jim Kim of the World Bank, go to 0 cases. Okay, so this is fundamentally important. And Minister Moore referred to the challenges that are posed by the animal hosts. I think an equally important, if not larger, challenge is the fact that these 3 countries are really kind of very deeply interconnected: Guinea, Liberia, and Sierra Leone. And the situation, unfortunately, in Sierra Leone in particular, is nowhere near as good as it is in Liberia. There, the number of cases in the last 21 days is over 1,000 cases and a large number of deaths. And we know that people travel between these 3 countries all the time. That's how it first spread from Guinea to the other 2 countries. And there have been substantial degrees of reinfection. As Guinea made progress some months ago and had much lower cases, flowed back through travel of relatives, going to burials and other things between these 3 countries. So quite apart from the bats and other animals, whilst the epidemic continues to rage in the other 2 countries, Liberia will face formidable challenges. And I think, of course, the government of Liberia thinks about Liberia, but the international community must think of those 3 countries and getting to 0 cases as quickly as possible in those 3 countries. It'll be impossible for any of these 3 countries to really eradicate the disease whilst it continues to fester in other places. So that's the first point I wanted to make. Let's think about the after, but let's keep quite a lot of attention focused on the during and on the treatment and prevention that are necessary to get to 0 now. My second point relates a little bit to the work that Amanda mentioned, the work we did trying to estimate the costs of the economic impact, rather, of the epidemic, both last year in 2014 and estimates going forward. And this is work, actually, incidentally, that was carried out largely by my colleague Dave Evans, who's sitting somewhere in the audience here, as well as Mead Over from the CGD, who's been working very closely with us in this panel, and a number of other colleagues. And one of the things, I won't get into all of the numbers and so on, but one of the things that we found out as we were looking at the economic impacts is that the economic impact of Ebola, of course, they reflect to some extent the medical costs, the costs of foregone work by people who are sick or who unfortunately die. But the largest costs are actually not from those things. The largest costs are from what we call aversion behavior, which is probably a fancy word for fear, and often very well justified fear and aversion behavior. So what happens, and we have recently a number of surveys that have been done that confirm this. what happens is that places of employment close. It's harder to get people to farm together in groups because there's a fear of farming in groups. Demand for all kinds of services and commodities decline. Mines didn't typically close so much, but they postponed or canceled investments going forward. So there's a general effect through economic activity that caused, we heard the senator mentioning earlier how, and I think the minister also mentioned how growth in Liberia was of the order of 5 or 6% before this epidemic, and in fact was forecast to be in the order of 5 to 6% in 2014 and 2015. Instead, it was, by our latest estimate, 2.2% last year, and the forecast for this year is of the order of 3%, already reflecting some of the improvement that we've been seeing. But if you add up the foregone growth, the output that Liberia would have produced and didn't because of the epidemic, that's of the order of $250 million for Liberia alone, which in this, a very poor country is a very considerable sum. If you add the three countries, it's as much as $2 billion, according to our latest estimates, of foregone economic impact. And most of that comes from this aversion behavior. And therefore, the biggest thing you can do to reignite investment and economic activity is to fight the epidemic so that the fear is displaced and the fear is replaced with confidence, right? And just yesterday, the bank launched a new study based on a phone survey that's been done recently. The cell phone surveys that are done by the World Bank together with Gallup and some other partners. There are a number of caveats methodologically about those surveys, so I don't want people to be overconfident on the numbers, but nevertheless, they provide a kind of unique insight by actually talking to people on the ground now about what they're doing. And the reflections from those surveys, that come out are substantial declines in wage employment and self-employment. For those people that are working, lower incomes, okay? And those impacts are not happening only in the areas that are directly affected, but across the country. And the reason is, some of these transport links. It's very hard to move things to Monrovia and so on. So there are, the effects captured by the cell phone surveys spread across the whole of the territory of Liberia, not only the most affected places. Okay? Incomes have fallen, rice prices have risen, food prices more generally appear to have risen. The impact on agricultural employment is actually lower than we thought. Agricultural employment is more resilient, but people who've reported on the harvests that they've had report lower harvests and slower harvests to complete, largely because of this difficulty of having the teams work together in the farm. So it'll be interesting to hear later from the minister whether that matches with the perception that the government is having. That's what's coming out from our current work. That leads me to my fourth point, which is just the one before last, which is when we do think about the after and about the investments for recovering Liberia from this epidemic, what are we thinking about? And I want to emphasize here the importance of rebuilding and protecting Liberian human capital. So we've heard about the challenges on the roads. We've heard about the challenges on the power. I think all of those things are tremendously important, and they were always structural challenges to the Liberian economy, and they remain that way. This epidemic, of course, didn't destroy any roads, but it has the potential to have had a substantial impact on human capital. These are families that were already either in poverty or just near the poverty line. As their incomes fall and food prices rise, the nutrition that Liberian children are having in the poorest parts of the country now must be under threat. We don't have data exactly on malnutrition in Liberia yet. It's very hard to collect that data. Cell phone surveys don't do that, and for obvious reasons, you can't have enumerators in the field. But everything that we see suggests that there's, this increasing poverty could be a serious problem for nutrition amongst children in the poor amongst the poor in Liberia, which is most of the population. Similarly, schools have been closed for long times. So what education was going on has stopped. So as we think of recovery and investment going forward in Liberia, of course, a lot of the attention is centered on roads, on powers, on involving the private sector. All of those things are good and true, but let's not forget that for the bulk of the people, investing in them and their human capital, particularly in children, is fundamentally important. And there are things that I think the government can do through cash transfer programs, through immediate forms of social protection, trying to reach out to these places. I know that there are conversations taking place about that with my colleagues at the World Bank and others, and I think that would be a very important part. It's easy to think of an economy as centered around just banks and businesses and large mines. That's part of the problem. We want an economy where people are productive, and to have that, you have to invest in them. They've been under severe stress over the last, as I say, both in areas where Ebola has been present and elsewhere because of the economic impact that I described. My last very brief point, and I was heartened to hear Minister Moore talk about the perceptions of corruption and what the government is doing to deal with them, both the sunlight to air them out and efforts to contain it. The fifth issue that I want to raise is the issue of governance and the importance of that, right? And there is a lot of aid money coming in. As was said before, quite a lot of it is not to the government, but some of it is. And if we're talking about cash transfers, if we're talking about reaching out quickly with social protection and education spending into these more rural areas and so on, it would be very important to keep a very strong eye on the governance and the accountability of how those flows are managed and so on. Lastly, just to respond briefly to the point that was made about procurement rules at the World Bank, I was mentioning briefly to Minister Moore on the way in that I just recently became aware that we're actually having a procurement reform at the World Bank as we speak. Somebody just came over the other day to the Africa region and explained to us they're changing various things in the procurement rules. Not typically something the chief economist pays a lot of attention to, but in this context, seems to be quite important and appropriate. And maybe we can see, I'm not sure whether that particular aspect, the sort of, the requirement of turnover for firms is being changed. But if they're changing the whole thing, maybe we can look at that. So I'll follow up on that, and maybe we can have ongoing conversation with the government through the country director's office and so on.
Sure.
Those things.
Excellent.
Thank you.
Okay, well, thank you very much, Chico. Welcome to Jeremy Konyndyk, who's the head of the Office of Foreign Disaster Assistance at USAID and is leading the U.S. government response to Ebola. We've had some great remarks by Senator Flake and Minister Moore about U.S. Congress's view on the Ebola response and looking forward in Liberia. Minister Moore has talked a lot about what priorities are for the government and some issues about how we manage aid, how we can minimize distortions and increase accountability, given that a lot of that aid is running outside government. So would you like to say a few words about the U.S. response, how you see the after/parallel efforts on recovery?
Yep, wonderful. Can everyone hear me? I'm convinced I put this mic on wrong.
Yes.
It's much higher tech than I am. So the president has been very clear that this is a huge national security priority for the United States. I can't tell you the amount of White House attention that this has received, much more so than anything else that I've worked on in this job. And there is a really deep commitment to driving this disease to zero in Liberia, but not just in Liberia, in all of West Africa, because we very much realize that it's not gone in any country until it's gone in every country. And so to that end, while we have huge investments now in Liberia to drive this to zero, we've also really scaled up our presence and our effort in Sierra Leone and Guinea. We also sent a pretty substantial USG team into Mali when some new cases emerged there, and fortunately seems to have dodged a bullet for the time being there. That's not wood, is it?
It's not wood.
So I think I feel very confident that we will achieve that, and we will achieve that. I think it's wrong to say actually we will achieve that. I think we will achieve that in support of the governments of Liberia, Sierra Leone, and Guinea, who are in the lead. And I think that's the first critical point to make in terms of the question on how the U.S. plugs in and the accountability question. We are very, very clear that we are in this in support of the government of Liberia, the government of Sierra Leone, and the government of Guinea. And those governments are in the lead. We are there in a support role and an advisory role to help them to defeat this disease. To do that, we've mobilized what is a little bit of a dirty phrase in CGD, I think, Todd, whole of government response to this to this crisis, but the good kind of whole of government response, the really effective kind. And you know, we've done that because we're very clear that no single part of the USG, and we've got a CDC colleague who just walked in over there. No single part of the USG has the capability to do this on its own, and so AID has some very useful capacities to lead this fight. But we don't have everything. We don't have the deep epi knowledge, the deep medical capabilities that CDC has. CDC has world-class, amazing capabilities, but they don't have the operational, the operational and implementation capabilities that AID has. None of us have the logistical capabilities that DoD has. Another critical interagency player has been the U.S. Public Health Service, which is running the Monrovia Medical Unit, the high-end medical facility and treatment facility for healthcare workers and other responders. You know, that capability is pretty unique to U.S. Public Health Service. So you need that package in order to respond effectively. No single part of that can do it on its own. And a really important focus for USAID and for my office at OFDA since the Haiti response in particular has been to build out our ability to do whole of government work effectively. Clear roles, clear responsibilities, investing in relationships, investing in interoperability, and we're seeing the payoff of that in this response. And it's never easy, it's never perfect, it's never perfectly clean, but it's at the end of the day been very effective. And it's been we're now at a point in Liberia where confirmed cases in August were 30 to 40 per day. We're now down to a point where that may be as low as 1 per day. So that's huge progress. It also means it's kind of a dangerous time because there's a temptation then to say, okay, we're down to 1 a day, almost there. In fact, we're not almost there. There's a lot of work to do to really extinguish this and have confidence that we've extinguished it. And you don't fully declare one of these outbreaks over until you've been through 2 cycles of the potential incubation period for the disease. So when we see what we think is the last case, and then another about 42 days have gone by, then we'll feel happy. But that whole of government response that I referenced is coordinated through USAID's DART, Disaster Assistance Response Team platform. And so when the president said back in October that USAID was leading the strategic backbone of the response, that's what he was referring to. It doesn't mean we're doing all the work, but we're sort of at the center of the web and trying to make sure that all of the pieces are working in sync and in a coordinated way, and not getting in each other's way or duplicating effort or pulling in capabilities that are unnecessary. The trajectory we're on now, I think, is increasingly positive in Liberia. We are feeling guardedly better about Sierra Leone. I think Sierra Leone had everyone very scared in November and December. It looked like cases were continuing to climb at a pretty frightening clip. That's now leveling off and perhaps even starting to decline, and we're guardedly optimistic, I think I would say, that we'll start to see Sierra Leone follow a similar trajectory to Liberia over the next month or so with an increasing drop-off in cases. Huge amount of effort and huge amount of work still needs to go in to make that happen. Guinea, we're still somewhat nervous about because while Guinea has never seen the kind of explosive case growth that the other 2 have seen, it also continues to spread into different parts of Guinea and pop up in different areas. And so we've made additional investments there. The French have made additional investments there. The UN has made additional investments there. Those are starting to come to fruition now, and we're hopeful that will pay off. But then the big question of what this is more focused on, this event I think is more focused on, is what comes after all that. So say we get to, I'm not going to name a month, but let's say we get to some month later in this year, and we've seen what we think is the last case. What needs to follow on? Well, what needs to follow on is what is now starting. We're not going to wait until that last case emerges. We need to invest in a few areas. We need to invest in building out stronger healthcare systems. That's very clear. But not just stronger health systems, but healthcare systems with different capabilities. Because these healthcare systems could have been a lot stronger than they were. They still would have had trouble with this disease because they'd never seen it before. And it's a very pernicious disease. It looks and acts in the early stages a lot like a lot of other diseases in that part of the world that are much more common. And that was one of the things that enabled it to go as far as it did before it was recognized for what it was. So we need stronger healthcare systems, yes, in general, that's clear, but also healthcare systems that have greatly improved infection prevention and control, and protocols and systems for recognizing and dealing with this sort of disease. We need stronger epidemiological surveillance, disease surveillance systems, so that we can recognize this sort of thing for what it is much, much earlier on. If this had been recognized in the first month as opposed to the third month, it would have been much easier to contain. So a lot of work to do in the health sector. But also there will be serious economic impacts of this. Probably not in the long run huge macroeconomic impacts out of this, but a lot of microeconomic impacts, a lot of household level and community level impacts. Families that have lost caregivers, have lost breadwinners, children who've been orphaned, communities where a huge amount of the population has been wiped out by this disease. There are going to be a lot of those sort of impacts that are going to endure, and will need support going forward. A family that's lost its breadwinner, a child that's left without parents and is stigmatized, is going to have a very hard time, is going to need assistance, but smart assistance. We need as well to ensure that the economies of these countries in the short term, and I think you were touching on some of this when I came in, the economies of these countries in the short term are stabilized so that the hit that they're taking in the near term doesn't translate into some longer term damage.
Mm-hmm. Okay, well, thanks very much, Jeremy. Mead Over has been working on the economic impact models with the World Bank team, but he's also had the opportunity to attend a meeting at the World Health Organization a couple weeks ago on health system impact. And as a good health person, I have great fantasies about what could happen, and we all talk about a better health system. But in reality, how much money is available per capita? How would that financing be organized? What are we talking about when we talk about better health systems or better health response? Mead?
So that's a good question. And the comments beginning with Senator Flake and Minister Moore and the subsequent comments by the other panelists have all talked about this a little bit. And I want to put out what I think is probably a fairly provocative proposition. The question, as Amanda raised, is how should health systems be strengthened in West Africa and in Liberia particularly in order to prevent another Ebola epidemic? And that question was addressed by the meeting I attended in Geneva, December 10th through 12th, by ministers of health and of finance, including some of Minister Moore's colleagues from Liberia, and also their similar people of similar rank and authority from Guinea and Sierra Leone. And there were representatives from all the major donors, I would say, including the World Bank. Some of Chico's colleagues were there. Tim Evans, who's the director of health, for example, was there. And this question was raised, and the discussion was almost entirely about what here I'm calling Model A. We need to put a lot more money, people were saying, into developing the health systems of the West African countries so that they look a lot more like American health systems. And when I was sitting there and scratching my head and wondering what they meant, I was wondering if they meant for the health systems and the hospitals of Liberia, for example, to look like the Presbyterian Hospital in Dallas, Texas. Well, the Presbyterian Hospital in Dallas, Texas, in fact, was not able to prevent nosocomial transmission of the disease once a case arrived. And also, I want to point out that the outbreaks that have occurred in Uganda and in DRC over many years have occurred but been quickly isolated. And I think it's important to ask how those countries have learned to be able to control this epidemic, to first of all, identify it quickly, and secondly, respond quickly in order to quarantine people without very strong health systems. So given the fact that that has been possible, the question is, why was that not possible in West Africa? And Minister Moore pointed out his extraordinarily nuanced and detailed remarks were fascinating, I think, to all of us. But one of the things he discussed was the fact that people of West Africa had never seen this disease and actually didn't really believe in it. So that reminds me of the early days of HIV, when people in Africa didn't believe in HIV. And it took some time for people to become aware that this is a dangerous disease. But the question is that given that awareness now, what sort of strengthening of the health system is might be sufficient to prevent the next Ebola outbreak, and what sort of what should we argue is actually necessary to accomplish that objective? So the next slide is a slide. Next slide, please. Yeah, the next slide was prepared by David Evans at WHO, not David Evans of the World Bank. David Evans of the WHO is the head of the economics and policy unit there, and he made this slide in order to argue that the overseas development assistance that's been flowing into the 3 affected countries has been misaligned. The slide points out, and you see the part in blue is all for vertical programs. The part in red is the overseas development assistance that's gone into strengthening the health systems. He did not say so quite so definitively as I will now say it, but I think he was arguing that if this had been different, if all of this money had been in the red category of general health system strengthening, the Ebola epidemic would have been prevented or greatly, or have had much less impact. I don't think that's well established at all. I do think that there are strong reasons why foreign donors preferred to put their money into vertical programs, and those reasons have to do with accountability. Mr. Moore talked about accountability, and Amanda asked Senator Flake about accountability. Accountability, we were talking about accountability for where the money goes. But in the more fundamental sense, accountability is to try to get health benefits for the money that's spent. And the reason that donors prefer, in many cases, to put their money into vertical programs is exactly because of the vertical accountability mechanisms that can be designed into those programs and can assure that the health benefits actually accrue. So with that in mind, how might one go about thinking about strengthening the health system so that it could, in this Model B sort of way, where in fact you could have very strong disease surveillance capability to be able to detect a new outbreak of meningitis, of cholera, of Ebola when it occurs, and then have a response of the sort that we now know is necessary. So the next slide will be one that's very familiar to Minister Moore. This is a map of all in the red dots are all the health facilities in Liberia. The green dots are the Ebola treatment units that had been in place late last year. I believe there are somewhat more than that now. But strengthening those health facilities by simply trying to raise them to the standard of the Presbyterian Hospital in Dallas, I would suggest is not the answer. I'd very much liked Minister Moore's suggestion of roads to health. Many of these red dots that we see on the map are completely isolated because of the lack of transportation. And so clearly, I would put strengthening those roads as one of the inputs that's necessary, if not sufficient, to prevent the next Ebola epidemic. But then I would argue, the last slide, I would argue that more than that, there needs to be some kind of regional strengthening, not only of surveillance, and I very much like the idea that you say President Johnson Sirleaf supports, which is to maintain the CCC units in order partly to act as a buffer for the existing health center so that they can feel more confident when they accept patients to them. And also because the CCCs are serving, I believe, if I understood you correctly, as a first-line surveillance network, and they're collecting information and passing it on to the ministry. I would, I tremendously support that as what I would perceive as a necessary way to strengthen the system. But I wonder if, in order to be sufficient, there needs to be a regional mechanism that does what each individual Ministry of Health is now doing. The people in the hazmat gear and the protective suits who come in on hopefully your strengthened road system in order to identify whether people are truly Ebola cases that need to go to a treatment units or not. Those people might come from a regional source. Now, in April of 2014, the African Commission proposed at a meeting organized by the World Health Assembly in Africa that there be an African Center for Disease Prevention and Control, ACDPC, right? that the African region of West Africa have that capability, which now exists arguably only in Atlanta at the Center for Disease Control. And I support that as a possible solution, which together with this strengthened on-the-ground surveillance could actually be both necessary and arguably sufficient to prevent the next Ebola epidemic.
Okay, well, thank you, Mead. I just want to point out that this is not a World Health Organization slide, in case Mead was using some old template. This is
I
not
used David
actually their
Evans'
view,
slide,
correct?
and then unfortunately I dropped mine on top.
Okay, just so
Background's
that
still
our
there.
poor colleagues from the WHO don't have a heart attack. What? Minister Moore, so you've had a round. You've heard what others had to say. We've also put out a draft of an open letter that tries to summarize some buckets of response priorities in the recovery period. We're talking about households, just getting households back on their feet, dealing with these nutrition and early childhood effects, health systems. We've talked about that. I have less clarity on what that actually means, whether it's just this regional disease surveillance and rapid response mechanism, or whether it's something more comprehensive to support the recovery of the health system of Liberia and its neighbors. And then a third category, which has to do with firms and economic recovery more broadly. So what are your reflections after hearing everyone's 2 cents, all the work going on?
Sure.
Thoughts?
Is this thing up?
Yes, it is.
Okay, great. Yes, so first, definitely we have to recognize the regional aspect of the outbreak. About 2 months ago, there were a couple of incidents across the border from Liberia in Guinea, and we sent our right teams, and the right teams are the basically rapid response teams, and they went over into Guinea to try to do it. And there's already precedent with the three countries working together. We have a flight information region, so Liberia, Guinea, and Sierra Leone, so that for flights entering the airspace of the three countries, we collect the information and we share the revenue that comes from that. So there's already precedents in place for the three countries cooperating on information sharing. So something like that, like regional surveillance, would work for the three countries. And like he said, if even if we were to get to 0 cases in Liberia, because of the long and porous borders and the family relations across the borders, it is going to be very difficult for us to keep from reinfecting each other. So the three countries will have to be considered together. Unfortunately, I'm a minister in the Liberian government. That's what my concern is primarily. But we should definitely see the regional implications of this. On the issues of the numbers, again, I think there is healthy tension between us as the government and those responding to it. Because when we hear the numbers are aggregates, and there's an aggregate of confirmed, suspected, and probable cases. And so when you combine the aggregates, it sounds like a bigger number. Again, we're at no place as a government where we think that the crisis is over and we should step away from the crisis now. We still, one Ebola case can generate 100. And so one Ebola case present in the country remains a threat to our country, and we will not stop. We'll continue to be vigilant. Our thing is to ever get to a place where we've gone 42 cases without 42 days without an Ebola case, for the WHO to announce that Liberia is now Ebola free, for that to be the starting point of our economic recovery is to ruin ourselves, and we're not going to do that. Also, this year, like some people have said, it's 5 years since Haiti. And the hope and advantage to being a human being is that we're heirs to this body of knowledge so that we don't repeat the same mistakes. And going forward, for us in Liberia, Guinea, and Sierra Leone, we're trying to be very cautious in terms of how the response is managed. Because of the food insecurity problems, because of the loss of livelihood, there is a strong and current need, continued need for NGOs and the response in that manner. But the economic response cannot be led in that way. Otherwise, Liberia, Guinea, and Sierra Leone, 3 years, 5 years from now, would be where Haiti is today. We will have to balance that with strengthening the private sector. If people have jobs that they go to and get paid for it, if people are able to generate wealth working, that is the only way the economic recovery will be sustainable and robust. In terms of money coming to the government, we have, I promised yesterday that we checked, I think it's PricewaterhouseCoopers. we have hired to do an audit of how we have used money that has come to us for Ebola. And that is going to be published. It's going to be given to the legislature, but it's also going to be published so that everybody is comfortable with what Liberia has done with monies that have come to Liberia. As for monies that do not come to Liberia, we can only encourage our partners to be as open as we are in how the money is being used and how it's been expended. But in terms of the cash transfers, I think that will work in a place like Liberia, especially for livelihoods, and it should be something that would be encouraged. Now, how would it work? The U.S. government has this really awesome thing called FARA. I
Fixed amount reimbursement agreement. Right?
Outstanding. That's it, right? And what they do is basically they come into the Ministry of Health or come into Public Works. My predecessor signed an agreement with USAID, and so they're going to start with us shortly. But they come into the ministry and assess the strength of your public financial management system. And then where you have weaknesses, they propose a whole slew of interventions to strengthen it. Once it becomes strengthened, then they do these reimbursements. So money is coming from the U.S. government will come to you, but as reimbursement after it's been proven that you met the benchmarks and done what you've done. And they've been supporting the Ministry of Health in Liberia with that. They're signing these agreements with other ministries and being able to do that. I think that is an excellent model because what it does in the long run is strengthen the capacity of the ministries and agencies that you're working with so that their systems is actually the people themselves that are running the systems. So I think in terms of cash transfer and governance, that will be uh, and then we're opening schools on February 2nd. We've gone almost a full year with our school, but we're doing all the prep work, water stations for kids to be able to wash their hands and everything that needs to go there, having nurses at the school so if a kid shows up with a fever, what to do. Um, they so and second to the last thing is how can we use Ebola to strengthen our health system? So currently, every morning, there are calls into the incident management system. The county health teams will call and say, "Oh, 3 persons were sick. We tested one of them uh, is negative, but we're waiting 48 hours to run the second test. So now in that case, it's a possible suspected case, and every county will call in. Every day they do this. Is it possible that the health system that comes after this, instead of calling simply about Ebola, they can be calling numbers with malaria, cholera, and it's a very simple process. It doesn't have to be a very complicated system. Every morning, people call. Now, the second thing is the incident response has been broken into county health teams. So now they only depend on Monrovia if the case become more than the county health team can do. But in most of these instances, the response is coming from the local level. That also is a resilient health system because now response can come from the local team. And my final thing is that as for a country like Liberia and countries like our brothers and sisters in Guinea and Sierra Leone, at some point the conversation about donors will have to end. I mean, it's very difficult for people to respect you when they feed you. It's just part of the human experience. And at some point, we have to be in a position where we can provide for ourselves, we can do things for ourselves. And the way to be able to do that is to be able to build our economies, is to be able to add value. As long as Liberia, Guinea, and Sierra Leone continue to export logs and iron ore, we're 10 years from now, 20 years from now, we're going to be back in the same place. We can use this Ebola outbreak and economic recovery after this as an opportunity to begin to invest in the private sector in these countries in such a way that it is a resilient, and I keep coming back to resilient and sustainable. Because the thing about aid is whether you like it or not, no matter how well it's crafted, eventually people become dependent on it. People develop skills that the system rewards. And if the system rewards those who write very good grant uh, proposals, then those are the skills that people develop. And so we look forward to a bigger role for the MCC in Liberia. The MCC, with its focus on the private sector and infrastructure, will be a significant partner. I'm not just saying that because Evan is here.
But he is here.
Oh yes, yes. But that and the ability to be able to match um, Steve talked about an enterprise fund, maybe even for the Liberian diaspora, so that you mirror what happened with us as the Scott Fellows. I, 5 years ago when I left DC and went to Monrovia, I did not think I would return as a minister in the government. But the good thing about the Scott Fellow program is that almost every single Liberian who went to Liberia under that program stayed. And whether they worked in the private sector or worked in the government, they stayed. Well, some of the guys got married and left, but you can fault them for that. But they stayed. If we can have a similar program for entrepreneurs in the diaspora who want to go back home and become involved in the private sector, but access to credit is an issue in a place like Liberia. If we can find ways to be able to strengthen those places, I think we'll be able to move forward. I've been talking for a while, so thank you.
Thank you, Minister Moore. That was great. Okay. Let's say we have 10, 15 minutes, so let's go to a round of questions. Right here in the front row, please say your name and where you're from.
Good morning. Thank you to all the panelists. My name is Tiaji Salam Blyther. I'm coming from Congressional Research Service. I want to have a few questions for Minister Moore. I think you gave an outstanding presentation.
Thank you.
You did a really good job at hitting on several points and interlinking them in ways that we often don't. I want to give you accolades on that. And before I do that, I just want to give a small pushback to Mr. Over about the health system strengthening piece.